If you could leave families and caregivers with one message about how they can navigate emergency care for their older loved ones that they're bringing in, what would you want them to remember?
Welcome to the Empowered Elder Podcast.
Previously on the Empowered Elder Podcast.
Age-friendly health systems. It's an initiative that was started by the John Hartford Foundation as well as the Institute for Healthcare Improvement. Basically is an initiative that really focuses on what matters most in caring for an older adult.
Well, welcome back to the Empowered Elder Podcast. In the first part of our conversation with Dr. Holly Bushorn, we explored the realities of emergency medicine and the unique challenges that older adults often face when they arrive in the emergency department.
Dr. Bushorn shared how her experiences during the pandemic, along with the gaps she saw in traditional emergency care for older adults, ultimately led her to step into leadership at the Western Colorado healthcare system within the VA, where she could begin addressing those challenges at a systems level.
In today's continuation of that conversation, we're diving deeper into the solutions, including how the VA is implementing age-friendly healthcare practices, what the 4Ms framework means for older patients, and how programs like Geriatric Emergency Department Accreditation and the GeriVet program are transforming care for veterans and their families.
Because when healthcare systems intentionally design care for older adults, it doesn't just improve medical outcomes. It empowers patients, supports caregivers, and creates a better experience for everyone involved.
So let's continue our conversation with Dr. Holly Bushorn.
Basically, age-friendly health system. It's an initiative that was started by the John Hartford Foundation as well as the Institute for Healthcare Improvement. But it basically is an initiative that really focuses on what matters most in caring for an older adult. And it breaks things down into what is described in medicine as the 4Ms. What it does is it addresses 4 specific areas with older adults. So the first one is what matters, and so matters, and basically it prioritizes the goals and preferences of patients and their families, and that can include what kind of care they want, exactly how they want their care delivered, and also it kind of gives you an idea of really what they're after. For instance, I had somebody that recently came in that had a full goals of care discussion and documentation prior to the ED visit, and when they presented, they were sick, and there was the tipping point of possibly needing dialysis, but they were clear, and we were able to have that discussion of what matters, that they wouldn't want dialysis, and so we were able to tailor their treatment. Just because somebody says they don't want a certain something doesn't mean they want a different aspect of care. Some people don't want invasive procedures, yet they would be willing to accept fluids or antibiotics or something like that. So knowing really what the expectations people have when they're interacting with healthcare is super important. And for us to be able to understand what it is really can help us to tailor the treatments. The second M is medications. So with older adults, it's very common that there's multiple medications prescribed for multiple medical conditions. Sometimes they can interact. The pharmacokinetics are different in older adults. The older you are, you metabolize medicines differently. And there are certain medicines that are really just not good for an older adult to be on. And so, really this program kind of has us focus on review of medications, and if there is a concern that we, could be potentially causing harm by all the medicines. And continuing with the age-friendly, the third component is mentation. And so with this is really trying to identify, treat, or manage dementia, depression, or even delirium, which in delirium is when people are acutely confused, usually due to an underlying condition, whereas dementia is a progressively worsening condition of decreased memory. That really has us focus on that, and if there is an identified concern, trying to get help early. And then the last M for health friendly is mobility, and that really ensures that that we focus on an older adult's mobility. And for the ER, falls is really important. And this really helps us to focus on ensuring that people can move safely and really tries to maximize function. So the age-friendly health system really focuses on that. If we identify that somebody is having difficulty with, accessing healthcare, we also have a program here, a home-based primary care, where providers actually go to homes of veterans, because that is one of the barriers that people don't realize is, transportation, and that's across all boards, not even just geriatrics. But and so there's a ton of opportunity for supporting our veterans with the resources we have here at the VA. And I think by implementing this GeriVet consult on the patients that are identified as potentially needing some extra help, we're really able to get them the resources they need.
What an amazing program that is offered. I mean, it's all encompassing, and it just sounds like it's all the patient is benefiting and the doctors too, because what type of care they're going to need out beyond the developing, knowing what the acute care and the reason why they came into the ER. I'm just curious about how long ago, when was the first GeriVet program established, and how many other veterans hospitals are undertaking this, or is it just still limited and you're still growing out the program?
So yeah, that's a great question, and I don't know how many VA ERs have specific GeriVet programs, but where they do this specific consult. But I think it's a lot, because if you look at the map on the ACEP website, you can actually see who's all accredited, because I think it really actually does show what VA is doing for older adults. But it's the majority of ERs and urgent cares within the VA system at least have a bronze designation. And the National Emergency Medicine Office, which is basically we have individual VAs, but then there's like the central office out of DC. That central office really wants to focus on geriatric emergency care, and is really pushing to, or is really advocating for these types of programs in all the ERs. In fact, there is a specific subset of geriatric emergency medicine within VA, and to really support us and help us achieve these designations.
Have you seen any impact in non-VA services utilizing the lessons learned within the VA structure for geriatric care?
I think that's a lot of times initiatives will start in VA and then move out, and I think that really is one of the benefits of VA as a system as a whole. But I do think that it is, I realize that I'm very veteran focused, because that's what I do now, and that's what I'm passionate about. But there is, for families who don't have access to VA, I do think having the systems like age friendly and having the different like gold, silver, bronze designations really does help any family, whether you're a veteran or not. And you can actually go on the website, and there's a national map of which emergency departments have which level of designations. And so just out of curiosity, I was looking the other day, and there's only 9 emergency departments in the state of Colorado. 2 of the 9 are VA. So the VA in Denver, that sits next to Anschutz in Aurora, and then us here in Grand Junction are 2 of the 9 that have a designation. The VA in Denver is a level 1 because they're a huge facility with a ton of resources. But I'm
actually surprised with the concentration of military in Colorado Springs that it's not a Colorado Springs hospital that has the designation.
That's interesting. Well, and I think there's not a VA hospital in Colorado Springs. There's satellite clinics.
Got it.
But they don't have emergency departments. But that's again where there's lots of layers, right? And that's where age friendly can come in, because the age friendly health systems initiative, that's not specific to VA. Or I'm sorry, that's not specific to emergency departments. That program, you can adapt that to primary care, inpatient, skilled nursing. You can adapt that to whatever area of practice that you are, which I think is helpful.
Well, and what struck me is you were going through the triage intake questions.
Yes.
Those could also be questions that caregivers, family, friends, support system people could also be asking of their loved one to really identify where additional enhanced services might be needed.
That is a great point. Yeah, and that's exactly true. And it does kind of it really gives, sometimes you need framework, right? You need a framework of how to kind of conceptualize even what you need to ask for. And I think, there's, I understand with what you guys are, with the podcast, you have so many different areas that you're looking at, but within healthcare and accessing needs for older adults, as family, sometimes you just don't know what to do or where to go or how to even start. And sometimes just identifying things like, is my, family member, loved one, are they falling more frequently? Do I worry that they can't see or can't hear? Am I worried about their memory? All these things. And if you kind of go through and are able to ask that, even if you don't seek, or if you're not within VA, you can bring that to their primary team or primary care team. Because most offices in the private sector will have, a care team that's looking after patients as well. So there are additional services that could be gained.
That's super helpful. Super helpful.
We talked a little bit. We talked about how the GeriVet program benefits the patient. But what have you seen, or have you seen how the providers are feeling more supported with this program, and how has it made a difference for them?
I think it overall improves. I think it helps with both patient satisfaction and provider satisfaction. I think that people might not realize how much doctors think about patients after their interactions and how much we worry. And, and I think, especially when you're discharging from an emergency department, somebody that's high risk, meaning high risk is like there's, you've identified that there's not anything that's emergent right now, but they're vulnerable, and there's good chance that they're going to end up back, or there's a chance that whatever's going on is going to progress. The more resources you're able to provide to somebody, the better that makes you feel, both that you're taking really good, the best care you can for an individual, but it also gives a little bit more peace of mind knowing that you're going to have follow-up. One of the things that I feel like that I don't think I alluded to as much before, but one of the big things is follow-up. And that is really part of the, when we're talking about those different designations with ACEP and with silver designation, it's one of the big things is really making sure that we correspond with the patient's primary care providers so that they know they were in the ED. And, in the VA system, it's easy. All we have to do is basically tag their name or tag their name to the chart from the ER, and they'll know exactly what happened. Well, if you're out in the community, and that's one thing I remember, being worried about, is ensuring that a patient's primary care provider knew what happened in the ER, and trying to secure follow-up for somebody in the private sector sometimes can be challenging. You're already dealing with limited resources. Sometimes I remember calling physicians saying, look, this patient's okay, but they need close follow-up, but that takes an extra step in a busy setting. But with what we have set up here, it's very easy to just transition care. And I think by doing that, that really does provide provider satisfaction, because it's more of a closed loop in your with patient care.
Mm-hmm. That makes a lot of sense. Well, and I mean, we all have to remember that you went into medicine as a general statement. You doctors went into medicine because you have a heart for care.
Right.
So you're human. You're not a robot, right? You do care about people. That's probably what the initial calling, even, from the very early stages, was the driving force.
Right. I think that's very true. And I think that is one of the things that is really nice about working here, is that I really do feel like there are a lot of resources for us to, provide for the patients that we care for. And that just makes us, and we, sometimes do have a moment, more to sit down with a patient and really get to know them more, and just talk with them, like the things that we thought we went into medicine to do, and then, but in practical real life world, you don't have time to do that a lot,
right,
in a lot of settings. So it's really nice to be able to make that connection. And a lot of times you do identify things that, you see a medical problem, and that's maybe why they came in, but really that's not the issue. The underlying issue is, for instance, they didn't realize that they weren't taking their medications right, because they lacked that understanding of what they needed to do. And if you could, realize that they weren't able to manage their meds, that's an easy fix. That's something we can take care of. But if you didn't have the time to realize that maybe they were non-compliant with medicines, not intentionally, but because they just didn't know, if you can identify that and take care, and fix that problem, then somebody's going to do better. And having the time and the resources available to help situations like that is good. And I think,
Well, I think systemically, that's one of the challenges that we've heard about is across the board, there are not enough geriatric care providers. And as our population continues to age, it's even more pressure on the provider to get through the volume of people to try to help. So as the population is aging, how do you see the geriatric care, not just the ED, emergency department kind of services, growing to help serve that population?
Oh, that's a great question. And I really think, this is just one piece, right? But there's currently a lot of strain right now on the healthcare system in the U.S. And I think, you kind of alluded to it, to the fact that people just don't, there's not enough. You don't have to, there's not enough providers. There's not enough time. And it just makes it really challenging. And so I think by having programs like this and showing that there's other, that people are identifying the importance of this and creating initiatives, that is going to help. But I don't have that answer. I think that's a huge systemic issue that's going to take years to resolve. And especially as our population in general is aging, we're going to need a lot of support and services for older adults. And I don't know how we're going to fix that.
Yeah. What do you think could be done in the medical school level to kind of enhance the interest in this field? Because I think it doesn't have a whole lot of sizzle. And so, that students are looking for the more exciting paths.
Right.
Is there a way to kind of change that narrative to get more interest in this particular population of services?
Yeah, that's a great question. And I think there are specialties that people choose that are more or less focused on older adults. But I think things like, what Arizona did was great. They provided me an opportunity to see, older adults not as just those needing a lot of health care, but, being able to interact with people a couple generations above me, and seeing that you can have a vibrant, happy, independent life, and have a lot to offer and give. And I think something like that would be helpful, because it's not just seeing basically folks when they're at their worst in seeking medical care, and for these chronic medical conditions, when people are trying to get help with that, you're seeing people outside of that, and when you see people that are, when they're truly vibrant, it might make others want to help them more.
Sure.
If you see what people are on the other side, like actually when they're living life, not when they're seeking healthcare.
Right. You're seeing so many families that are coming into the ER. What would you, if you could leave families and caregivers with one message, right? A message about how they can navigate emergency care for the loved ones of their older
lightning round
ones
is
that
really
they're bringing
one
in.
answer, or what your first
want them
instinct
to remember?
is, which is
What
really
would
what
you
you've
want
been
them
doing
to know
along
most?
this path.
If you're
anyway.
interested in seeking emergency,
but what is
accredited
one word you would
emergency
use to describe
departments,
the VA's
you can look
mission?
online to see who locally it does have accreditations, like who actually sees the geriatric population as as a unique demographic that has special needs. I think that would be helpful, because if you go to one of those departments, that they're acknowledging that there are potentially barriers that they've actually addressed by different policies and practices. I think that's one thing. I think ensuring that people can get good follow-up after emergency department visits if they're being discharged, and working with the team either in the ER or at least having a conversation prior to being discharged of what am I supposed to be doing. You could say, what do I need to follow up? What are make sure you understand like what needs to happen after that visit. And everybody gets discharge instructions from an emergency department, but if it's listed out as, what you need to do, on Monday, call the primary care office for an appointment, and you were told you needed to be seen in 2 days time, and, understand I changed this medication or I added this medication. Just really, I think, making sure you have an understanding of what happened in that ER visit, I think will help a lot as far as, and also as far as, seeking care in emergency departments. If somebody's able to have somebody with them, I think it's truly helpful, especially if it's an individual that has a harder time voicing their needs or concerns, and that could be from somebody who has cognitive decline, or that's somebody that could be hard of hearing. All of those are issues that can be barriers for care. And if there's somebody that's able to be present with them, or even by phone, that is really helpful.
Is there anything we haven't touched on today that you think is an important topic for us to discuss?
As far as care, there's plenty of things I'd be happy to talk about. I can't think of anything specifically. Okay. Did you have quick questions you wanted to ask?
No, I thought that
clear.
Everything was super helpful and will be very helpful for our audience to really understand what is going on in the Grand Junction area, what's going on with the VA, how it impacts the rest of the community. So I think the information has been fantastic.
Absolutely. Excellent. Yep. Okay.
So we have a lightning round that we like to do as kind of the summary wrap up for our interviews.
Okay.
And we have 6 fast questions. The lightning round is really one answer or what your first instinct is, which is really what you've been doing along this path anyway. But what is one word you would use to describe the VA's mission?
Compassionate care to veterans and their families. That's not one word.
Okay. Yeah, it's good.
I just have been so impressed with how dedicated people are here with serving veterans. With whatever level they are, they contribute to providing compassionate care.
Well, that definitely answers the mission piece of that.
The second question is the most underrated habit for healthy aging.
I think activity and exercise.
What is a quality you admire most in the veterans that you care for?
I think one thing that sticks out is their adaptability. One of the things that really made me appreciate my work here is the gratitude that they express. I think we all feel grateful for what they have done for us in our country, but they show gratitude toward us as caregivers and providers. And, it's our job, it's what we do, but sometimes it's nice to get a thank you or, we appreciate you. And that this population is really great about showing gratitude.
The best advice you give to young physicians.
If you want longevity in a career, you have to look at it as a marathon and not a sprint. I think that it's easy to not take care of yourself, especially early in your career. And I think if you don't, then it can affect you negatively later on. So, taking time for yourself and your family is super important.
Good advice.
Yeah.
If you weren't in medicine, what might you be doing?
Well, I've thought about that a lot. And I have often thought if I had to do this all over, would I do it again? Or if not, what would I do otherwise? And I honestly kept coming back to medicine. I honestly, as much, as the ups and downs as I've had through my careers. And some of that is just, sadness over seeing bad things happen and, but also the joy of the positive things and, the collaborations that I've had and, all of that, I can't see doing anything else. But I will say that when I talk to my kids about what kind of fields they are interested in going into, I give a cautionary tale about medicine because it is it's a lot.
And rewarding. Yeah.
Yeah. It does. And that's the thing. It's got positive, everything has positives
Sure.
and negatives. And you just want to make sure that for you, it's, the positives outweigh the negatives. But
so I would say your passion comes through clearly, and this is definitely a calling.
Well, that's kind of you to say thank you.
Oh,
But
no,
yeah,
I'm not just kind at what I say. I'm very direct. Very
Yeah,
direct.
I don't think despite the ups and downs, I think I would still choose medicine again.
That's great. Well, we have one final question for you, and that is, what gives you hope about the future of healthcare?
What makes me happy is when I interact with, VA is big on teaching at all levels. Talking to others, seeing young people, but the young people that are still interested and willing to go into medicine. I feel like there is a lot of press about the bad things that are happening in medicine, and maybe that it's not the best thing to go into. But I think that there's still, when I see young people that I think have so much potential and interest and drive and passion that are choosing to go into healthcare in general, it gives me hope that our health system is going to improve with their passion and interest. And that is something that genuinely gives me hope for the future.
That's great.
I think this whole interview has given me hope for the
Yeah,
future. As we age, it's nice to know the impact. Seriously, it's nice to know the impact that you and your department and your facility are making on the aging population and the ability to maintain care in the community. So thank you very much for what you're doing and what you're driven to continue.
Oh, yeah, and for sure. And I think you touched well on that too. It's not just me by any stretch of the imagination. I mean, it's everybody, the folks in the ED. We had one of our former techs in the ER was really instrumental in pushing through a lot of this program. So we owe a lot to him, and it's also the facility that's really supported what we are doing in the emergency department. I think that's huge, and I do feel grateful to have that support, and I feel really grateful to have the department that I do and everybody that works, that works in the ED here.
Great team.
Well, thank you so much for your time.
Thank you.
Yeah,
have a fantastic day.
And thank you guys for what you guys are
absolutely.
doing. I honestly, as being somebody that's trying to care for an aging parent myself, it's daunting. And to have services that you can identify, or resources for help, it's huge.
Well, and hopefully the variety of the interviews that we're doing will give a good library of resources for all of our aging population, VA and otherwise.
Right on. Yeah. All right. Well, thank you guys. Take care.
Thank you
so
Have
much.
a great afternoon. Today's conversation reminds us that improving healthcare for older adults isn't just about new programs or policies. It's about designing systems that truly recognize the dignity, complexity, and lived experience of aging.
What Dr. Bashorn shared so thoughtfully is that meaningful change often begins inside the systems themselves. When leaders are willing to look at the gaps, advocate for better resources, and create environments where both patients and healthcare providers can thrive.
Dr. Bashorn, thank you for the work you're doing through the Western Colorado healthcare system and the VA to advance age-friendly emergency care. Your leadership is helping ensure that veterans and ultimately all older adults receive care that is thoughtful, coordinated, and truly centered around their needs.
And if today's conversation resonated with you, we encourage you to explore the resources and information we've included in the show notes, including links to learn more about age-friendly health systems and geriatric emergency department accreditation. We're your hosts, Nicole Robilotto and Tasha Beckman, and this is the Empowered Elder Podcast, where we talk about home, heart, and the next chapter of life.